So this was our panel for today, and it's sponsored by the Purdue Northwest Center for Global Studies. I want to thank all of the advisory committee that helped develop this program and arrange for our speakers. I'm Lee Arts from the Department of Communication, Meeta Chowdhury from English, Amlan Mitra, Economics, Kim Sipes and Alan Spector from Sociology, and Kathy Tobin from History. I want to thank all of those people, the Center for Global Studies, and also our co-sponsor, which is the Massachusetts Peace Action. Our friends there have also been publicizing this event. And of course, I want to welcome everybody that's joining us today in attendance. We hear every day about the status of this global pandemic and the responses. Good news is that vaccines are being developed. The bad news is that there seems to be strains and variants that are more infectious. And also there seems to be, in some places, a sudden request to stop wearing masks and reduce the social distancing and gathering in public places. Even with conflicting accounts, in some places the claim that it's a hoax and others that it's overstated and we just have to get to herd immunity, even though millions might die. Or there's those that think that the government should have a more vigorous health response. Ironically, or unfortunately, the empirical evidence is not always sufficient to persuade citizens and governments for that matter. The World Health Organization's latest statistics from the 1st of March show the following conditions. And I listed, there's 180 nations in the world. I just listed the 4 that we have panelists from today, and as well as the US. And you can see there's a dramatic difference between the conditions in these different countries. Brazil is kind of like the US, maybe not quite as bad, but almost 5% of the population has been infected, whereas more than 8% has been infected in the US. India is much better. Cuba is much better than that, and Vietnam is remarkable in the conditions that they've been able to establish for their citizens. But this is not my presentation. We have 4 scholars from 4 different countries that will talk about their nation's response. I want to ask everybody to mute so that we're able to have our presenters have unfettered access to presenting to us. Each of the presenters from the 4 different countries are going to explain what's the response in their nation, what is the health system, how the public has responded, and then if there's time, make some observations about the social conditions of life in their country. We will use chat for any questions, and you can ask those at any time. Each of the panelists is going to speak 7 or 8 minutes. After that, we will take questions from everyone in attendance, or as you can see up there at the top, there's an active Twitter feed. If you want to talk with people on Twitter, it's at itain'tovercgs. I'm going to introduce each of the panelists now, and then we go in the order that we had on our announcement. So our first speaker will be Dr. Gilshin Swartz, who's a professor of communication, University of Sao Paulo in Brazil. Written several books and articles, active in some research centers and also some social action groups. I'm not going to have time to present each of the scholars that are talking today, their whole history and their whole both research and teaching and their other activities. But we have asked them because they're outstanding and successful in their field. So our second speaker is Nguyen Thi Trang from Vietnam. She is in history and she teaches at the University of Education Thai Nguyen in Vietnam. Dr. Luis Alberto Montero Cabrera is a chemist. He teaches chemistry, researches in chemistry, and he's at the University of Havana in Cuba. And then our final presenter will be Subhashish Bandyopadhyay, who's in sociology at the Institute for Engineering, Science, and Technology in India. As I said, please keep your microphones muted. And if you have questions for any of the panelists or comments, you can put those on chat. And then after we've done with the presentations, we will have a more open discussion. So with that, I will begin with Gilshin. And Jason, Gilshin wants to be able to share the screen as well. So if you could make that happen, that would be great.
Okay, Gilshin, give it a shot.
Okay. Hello, my friends. Thank you, Professor Liartz, for this opportunity for us to connect our fellows from Cuba, Vietnam, and India. It's quite an interesting combination. And unfortunately, Brazil is the worst case right now. We are now responsible, so to speak, for 30% of global infections, 30% of global infections. So it's really a combination of sanitary, economic, and political disasters in the midst of a democratic regime, but a democratic regime that is under the, let's say, the rule, if we could use that word, because it's almost a state of anarchy right now. But let's say we are under the rule of a really undisputably fascist person, Mr. Bolsonaro, a former captain at the army, himself a terrorist, an extremist, has praised torture and has been a negationist, a white supremacist, a racist. And most of all, he's been actively promoting crowding. People, he goes out on purpose and provokes himself crowding in many places. And he refuses to, well, actually, the Minister of Health has changed 3 or 4 times. And right now we have a general, a military, supposedly a specialist in logistics, but we are lagging behind in vaccine rollout. We've been lagging behind in any and every aspect of health policies. And his, so to speak, rulings have also extended beyond the sanitary dimension into political, cultural, social, and economic dimensions. Just to have a clear perception of what's going on, let me share screen here. I want to share some information with you, and this is really shameful. And here you can see it's an animated graph, very interesting. Let me just take it back to the beginning of the pandemic. And you see here, this is the World Life Expectancy website. And this is selected deaths versus COVID-19. So Brazil, 2 cases, 0 deaths on 3rd of January of 2020. That is about a year ago. You have all these diseases: coronary heart disease, stroke, influenza, pneumonia, diabetes, violence, lung disease, road traffic accidents, and so on and so forth. So once we start moving here, you see how this has evolved. Let me refresh, and you'll see the evolution. You can watch the timeline moving on. Coronary heart diseases first, stroke. Rapidly, you see COVID coming up. By June last year, COVID is already the 3rd, then the 2nd in July. You see that coronary heart disease by August was being put down to second place, and you see how the acceleration takes place as compared to all other causes of deaths in Brazil. You can see also that violence is also on the rise, but nothing compared to what happens with COVID until the 9th of March. So right now we have 266,000 people deceased. We cannot do the same exercise here for other countries. And let's see for India. Again, there's a problem with our hearts, coronary heart disease. But you don't see violence, for instance, as such an important issue in India. And you see that it takes longer for COVID to actually appear on the map. It's a completely different situation. Only by September next year, COVID starts to emerge. And then it also accelerates by the end of 2020, December, January. And here we are. So basically, the distribution of causes of death in India is completely different. So it's not just a matter of how many people, of course, this is important, how many infected people, how many deaths. It's also what's the pattern and what kind of governance, what kind of ruling, what kind of government is in place. I also want to take you to this other perspective. This is an article that was published by one of our fellows at the Department of Film, Radio, and TV at the School of Communication and Arts, Esther Imperial Hamburger. And she is really one of our most important professors, and she specializes in film critic and the history of TV. So here she just published this article at the Harvard Review of Latin America, and she goes through a very interesting comparison of images. So on the left-hand side of your screen, you can see the building of Washington Hospital in Wuhan, taken from a drone, from a kind of image that's very impressive, because you see all those bulldozers, and they are rushing to build a hospital. And on the right-hand side, you see the Tarumã Public Cemetery in Manaus, with the bulldozers also, but just digging graves. So this is an interesting article. I'll share the link with you. And it's an interesting analysis of the war on images and how we are going through an issue here that is also related to the image we have of our countries and what kind of efforts our governments, our public policymakers, what kind of efforts are they implementing. Esther was born out of a Jewish family, and her parents were persecuted by the military during the military dictatorship in Brazil. Here you see SOS Amazon, because in the Amazon, we had the first outbreak of a more contagious mutation of the virus, and simply there was lack of oxygen. So people did not die of COVID in the Amazon. They died because there was no oxygen tubes at the hospitals. Despite early warnings by the manufacturers, by the doctors, the Minister of Health knew in advance that there was a problem with the supply of oxygen. But the president and the minister insisted, as Trump had done before, insisted on advising people to take medicines that are absolutely unrelated to COVID and are not scientifically effective against COVID. So instead of providing the basic supply of oxygen to hospitals, they just left all these people to die without oxygen. This is genocide. This is mass murder. This is necropolitics. And I'll come back to that issue later on. This has been headlines all over the world. I advise you to read this article. These are children, Sisters Arielle and Ariane de Jesus, in the favela in the slum of Paraisópolis. So it's not only a problem in the Amazon, because people think of the Amazon as a jungle, but Manaus, the capital city of Amazonas, is a big city, and it's one of the most important industrial poles of the country. It's like an export platform. It's a kind of a maquiladora. So it's an industrial structure that serves the markets in the richest regions of the country. And there was a lack of oxygen. But in São Paulo, Paraisópolis is a slum. And the populations, the poor populations, are also left to their own in order to fight this. So this is one example, a very strong picture comparing bulldozers, building emergency hospitals, rushing to save people in China and rushing to bury people in Brazil. It's really unbelievable. Moving on to another interesting perspective here.
I'm
This
not going to interrupt Gilson, but a couple more minutes and then we'll make sure
For
that
sure.
we have time in the discussion. Thanks.
For sure. I'll share the links in the chat window, but this is another timeline that's interesting because it compares different countries. And here you also can see, if you activate, you can see the number of affected people and the effects and how the United States is first, but then Brazil fastly accelerates to become the second country in infected people. So this is also an interesting timeline of the coronavirus outbreak. I'll share the link with you. This is the latest news in Brazil, is that the Minister of Culture and the Secretary of Culture in the state of São Paulo, they are fighting each other, and there is an absolute lack of support for culture, for the creative industries in Brazil. So what the Bolsonaro government did is that it forbids subsidizing artistic productions in cities that abide by sanitary conditions. So instead of supporting these cities where you have lockdowns or restrictive measures, he's canceling support for any city or any state that fights the disease. So he's actually a murderer. I'll finish in 1 minute. There are some videos here that I will share. I picked these videos from The Guardian. So I'll share this in the chat window for you to actually witness what's going on in Brazil. But I just want to finish my talk making reference to an interesting work. And it's called, let me see if I can move. Yeah, here we are. This book is very interesting as a, let's say, a provocation about what's going on with us in Brazil and of course in many other places. It's what Max Haven calls revenge capitalism. It's a very interesting book that was published last year, talking about the ghosts of empire, the demons of capital, and the settling of unpayable debts. What is revenge? Why revenge capitalism? Why are the elites fighting the poor, destroying our societies, suspending and canceling social rights and civil rights? Why are we living through this kind of necropolitics? That's a major, major issue here. What is revenge? It's a desire for vengeance, retribution motivated by revenge, an act or instance of retaliating in order to get even plotted revenge, an opportunity for getting satisfaction, revenge. So Brazil is a society that was founded on slavery. We were the last country in the world to abolish slavery. Racism here is structural. The elites seemingly act as if they were on a revenge thrust, a revenge against the people, a revenge against social policies, a revenge against social inclusion. So the issue here is really not COVID in itself. The issue here is a government that implements anti-people, anti-society, anti-social policies. And that's why we are now responsible, so to speak, for 30% of all infections in the world. Thank you. This was just our kickoff presentation, and I hope to share more information as we move on. Thank you very much, Professor Lee, and let's hope for the best.
Thank you, Dr. Swartz. And we'll take more questions. People should feel free to put them in chat, and then we'll ask those when we move to the discussion. Next, Trang Nguyen from Vietnam.
Hello, everyone. I can share my presentation. Okay. Hello, everyone. Please, my name is Trang. I come from Vietnam. Please allow me to present my paper about the Vietnam response in combating COVID-19, a lesson of a good epidemiological model. In the early 2020, Vietnam was anticipated that it would suffer severe infection from the novel coronavirus that broke out in China because of the long border the country shared with China, as well as the limitation of the national healthcare system. Contrary to this prediction, the Vietnamese have written their own exceptional story with very low reports infection and few people dead. How Vietnam gained success in combating coronavirus is my purpose in this presentation. In the beginning, I would like to make a short introduction about Vietnam health system. Vietnam health system is organized according to 5 administrative levels: the government, the province, districts, communes, and hamlets or village. However, Vietnam has around 13,000 facilities with more than 285,000 beds, both the public and private sector, in which more private hospitals located in urban areas. Vietnam has more than 400,000 health workers in the public sector. That means Vietnam has only 0.8 doctors per 1,000 people. This number is quite low compared to other countries in the East Asia and the Pacific Ocean. The number of doctors is in low income and low middle income country is 1 doctor per 1,000 people. Moreover, the medical facility and equipment in Vietnam have not met people demand. Overloading frequency occur in hospital due to the difference in doctor qualification between the local and central level. Patients tend to ignore the local level and to treat at central hospital. And we can see the picture which reflect about the hospital situation in the Vietnam, like 4 patients per bed, and the hospital lack of beds for patient and their caregiver. Thus, when facing with any pandemic, the Vietnamese government and the Ministry of Health offer react fast to prevent the outbreaks and spread of disease in the communities. However, the health system maintains some advanced factor through it can organize or coordinate and list other ministries to prevent pandemic. First, Vietnam has implemented and expanded immunization to prevent infectious disease. The second, the grassroots health network has been strengthened, developed, and well organized in village. Third, since the January 2020, Vietnam went much further than the WHO were advising. It was also mounting a full-on containment strategy from the beginning because of experience combating with disease, especially infectious disease like influenza, SARS, avian influenza. Four, the Vietnamese government had also increased the construction of field hospital, and they also encouraged the production of necessary medical equipment. And the fifth, Vietnam had also produced the medical products and gained some success. For instance, Vietnam is one of the first countries to successfully isolate and cultivate the COVID-19. And I want to introduce some picture about the house of Vietnam. They rebuild the old building and to become the field hospital in Ho Chi Minh City. And is the next picture is the Vingroup, the company, and they make the new ventilator for the government during that time. And finally, and I think it's the most important is the Vietnam. They also promoting the concentrated isolation and provide free treatment and basic needs for people. Therefore, the citizens in Vietnam, they cooperate with the government very well. And in the second session, I would like to mention about the response of government. In fact, as soon as hearing for the new disease in China, instead of deny or anger, the Vietnam government has faced reality and taken immediately action to mitigate the epidemic. The government and minister, especially Prime Minister Nguyễn Xuân Phúc, call for cooperation among the various ministries. All efforts were taken to provide information and introduce the measure to prevent and counter the spread of disease into Vietnam, and warn the citizens to avoid visiting the epidemic areas. And the statement, fighting COVID-19 is like fighting other enemies, and ministry, brands, and local must be not subjective. It's very popular in the Vietnam during that time. Moreover, the role of the local government were actually spent up, and local units given significant leeway from the central government during this fighting. In other words, the central government and the Ministry of Health given a set of rules, regulation, treatment, and guidelines. Still, they didn't replace local authority power to decide and detail policy. Therefore, local authorities base themselves on the specific situation in their locality to decide whether to keep students away from school or not, or when to implement social distancing measure or quarantine. Also, some of the issues raised by public opinion promoted by government to respond to the people demand and opinion. Notably, people opinion also contribute to change government policy. And the government policy also, they also mobilize our resource and its political system in fight against with coronavirus. And they also use the various modern technologies have been applied to strengthen tracking. The government also implement a comprehensive public medical surveillance system utilizing its local branch. And the mass organization and personnel such as the Vietnamese Fatherland Front, village women unit, village medical staff also joined with to prevent and control the COVID-19 pandemic in the Vietnam. As a last thing, I would like to talk about the response of citizens. The citizens in the Vietnam, they follow and support the rule, the regulation and guidelines from the government and the Ministry of Health and local level. Vietnamese people also change their behavior and cultural habits. Most of the citizens follow fire regulation like wearing the mask, taking a distant face, maintain distance, not gathering, and making the medical declaration. And you can see the picture about the Hoàn Kiếm Lake walking trees in daily life compared with the Hoàn Kiếm Lake during the social distancing. We can see they're different. The people in the first picture is a lot of people join with the legs, and in the social distancing, no one go around the roads and they stay in the home. Moreover, the Vietnamese people also show their social responsibility through donation to support disease prevention. Besides, the most of the rice free supermarket also help the poor people in the different time. And you can see this is the ATM rice. This is the creation in the Vietnam and the happy supermarkets. And it's free and the poor people can join and take anything they want. And finally, the central measure also, the Vietnamese government also provides a regulation to discipline violators during the pandemic. I think that the pandemic also changed our life, but at the same time, family value and the relationship among family members has become more closer. The pandemic also help people to understand about the value of health. The slogan "Life slow down" in social networking media in the Vietnam become popular, especially in the early April when the whole country implemented a social distancing. And I think this reason makes the Vietnam can control the coronavirus during that time, and a few people dead during that time. This is my main presentation. Thanks for your attention. Thank you again for your attention, and I welcome any other question about my topic. Thank you.
Thank you, Trang. We have a couple questions that I will share with you when we get to the discussion. Our next speaker is Dr. Luis Montero from the University of Havana. I just want to say I don't know if most people know that the US has a blockade against Cuba. So even something as simple as Zoom is difficult. So I'm not going to ask Luis how he technically made this connection, but I'm really happy that he's here, and it's not often that we get to hear directly from voices in Cuba, especially if someone like Dr. Montero's stature. So please, Luis, give us your presentation.
Thank you very much, Lee, for this very excellent opportunity for telling you something about the way we do it here in Cuba. That's a nice opportunity for doing that. I will share. Well, in fact, you mentioned how I connect. I'm doing a VPN. In fact, because the blockade, several companies are afraid to bring their services to Cuba, and that is the case of Zoom. Zoom is afraid of getting an amendment, something like from the U.S. government, and because that reason they are not allowing Cuban IPs to access Zoom. And in fact, what you must do is using a VPN. Fortunately, I'm related to several universities in this world, and I can use VPNs of them. That's okay. That's the way I do that. And of course, we Cubans, we learn how to overcome many of the barriers imposed to us, because the single fact that we live in Cuba, and we love our country here in Cuba, and we work for our country here in Cuba. We are sanctioned. We are all the time suffering several actions because the U.S. blockade, because that thing, and apparently there are not a good sensitivity about that, and many other things could be told about these facts. What I want to tell you today is about the situation with COVID. Let me share. I'll try to share the screen to my presentation. This is the one. Are you looking at that, perhaps, yeah, my presentation? Well, COVID-19 and Cuba, data to think about. Let me see. Here we can see something that one of the previous lecturers showed you. How is the density of medical doctors in Cuba? In 2016, you can realize there that given that the intensity of color is related to the density of medical doctors, you can see that Cuba, that is here, is having a very intense density of color. That means we are having a very high, and the exact figure have been told before by another presentation. In fact, we are having a high density of doctors per inhabitant. And it means that not only we are having the doctors, we are having the system for taking care of persons everywhere. We are not referring here to beds in hospitals. That's a reasonable proportion. But the caring population is taken just in where the people live. And we are having a distribution of around 120 families per doctor independently of the doctors working at hospitals, something like that. That means that the caring of persons in their home places is very intense. And in principle, the health of people is taken care by that people. We have all of us, we are having a file checking how we are, and they are taking care of that. That's the reason, because we can have here a very direct attention to people. And this is being a poor country, being a blocked country, we must stress our best options, and our best options is to take care of people. And taking care in public health is an advantage when you're trying to face this kind of challenges like the pandemic is. What was the response of the government to COVID-19? Well, first, massive inquiry after the first cases appeared in March 2020, and during the whole pandemics. In fact, at that time, we had very limited capacity for PCR tests, and the way was inquiries. In principle, all medicine students and many other volunteers came house by house, asking if people had some symptoms could be related to the pandemics. And in fact, that was the case, but a very successful for the first approach we had to that pandemics. At that time, all sick and suspicious cases were hospitalized, and even some asymptomatic people who were tested as positive by PCR. You know that asymptomatic people are a very important fact for transmission, because they feel well, they are having no symptoms, apparently they are healthy, but they are transmitting the disease. And that's a case when you are having a very unexpected spread of the infection, because the asymptomatic people are present and they are focused for that. Of course, another thing have been to follow the contacts of sick people and the contacts of contacts. And that was the way that with that kind of branching, you could be able to localize the most important cases that could be also themselves the way to spread the disease. It conducted to a certain kind of regionalization of focuses. In principle, that was that certain quartiers, for example, places or towns in Havana or other places were eventually closed when several cases appeared there. And this was a way to avoid the spread of the disease. During the long time, I was in a certain way a victim of that. Airports were closed, and the transportation, internal transportation in the country was extremely limited. That means it was also an action to stop the dissemination. Of course, a very, very costly, a very expensive action, but it was taken for taking care of people. That is a more important thing. The schools were suffering too. Classrooms were closed, and most of the teaching or the classes at elementary levels are still given by television. And the big problem is the university, because you cannot teach 6,000, 7,000 different disciplines by television. That means we are having certain ways for overcoming that problem. It will have been a truly big problem. PCR tests have been decentralized across the country. Now we are having laboratories everywhere, practically in all provinces in the country, and we are having around 20,000 tests per day. Remember that we must import tests, we must import the reagents for doing them, and we are now suffering clearly the worst economic actions against Cuba during the whole blockade in 60 years. It means it has been a very, 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 very costly and painful situation to rise these capabilities for doing testing and treating people. The treatments of people have improved dramatically too. In principle, it was kind of a say following the international rules, but now most of our own treatment have been developed, and they have been very successful. In that case, also we had problems with the blockade regarding the respirators. The company that was using was our dealer for the respirator, who was in Switzerland, and some months before the disease, the pandemic, that company was bought by an American company, and it was forbidden to sell us respirator. Now we are designing and producing some kind of respirator to supply the point. Of course, a very important point, I think, is that every week, and during the week too, the president of the country meets the scientists for getting information on how to manage things. I mean, the scientists are taking care, are followed, are believed to be the person telling how to afford, how to treat the problem. And of course, there is we have a popular system of interaction between authorities and population, and it is also a very good feedback for getting good results in this direction. Results are very clear. You can see now the cases have been per day have been increased, and the death, the confirmed cases during the tests have been increased up to 20,000, 18,000, 20,000 per day nowadays, since the very early times of the disease. And the confirmed cases are being still low. The highest cases are around 1,000 per day, but it occurred only 3 times during the whole pandemic. How citizens have responded to that? Well, the use of masks is massive nowadays. The elders are essentially self-confined. We have had problems with certain social events, both at the enterprises and in offices, and also religious activities that require certain meeting of people. They were the worst situations were occurring there, but they have been controlled finally. Generally, social distance is respected. Unfortunately, we are having a deep scarcement of goods for buying in shops, and sometimes it requires long lines. But fortunately, people are certainly following its rules for social distancing lines, and lines are made on open air. And open air is a defense for doing that. We are having a great expectation now on our vaccines. We are trialing 5 vaccine projects. One of them is just now beginning the phase 3 at the level of several 44,000 people being tested, randomly selected, at a very, very accurate scientific research for that. And we expect that perhaps at the end of this month or the beginnings of the next one, to have some expectation to begin back vaccinating people. And of course, the volunteer were always available for testing. This is another interesting figure I wanted to stress here. Fatality rates. You see, for example, let me follow Cuba. The rate is most for me for comparison. It's better to compare rates than comparing absolute figures, because in that such a case, for example, you can see that Cuba is now having a fatality rate of 0.6%. Extremely low fatality rate. It was not always the same. You see here, for example, that at the time of April last year, we reached 4% of fatality, but we learned to treat them. And now the cases have been increasing, but the fatality rate decreasing all the time. And that's the way why we can say that the treatment of diseased people, ill people, have been extremely improved in our country. You can see the comparison with other countries. For example, most countries are doing more or less, are also increasing the quality of treatment. The case of Sweden, for example, Sweden had rose. Well, it is this Sweden. Well, not Sweden. Spain, Sweden. Sweden rose to 14% in June last year. Now reducing that because of the quality of treatment. Unfortunately, for example, Mexico is not improving that value. United States, by the way, is more or less having the same story. Cumulative death also have been dramatical. This is an absolute number. The leader, the regrettable leader here in USA, Brazil, as the previous lecture told, Mexico, United Kingdom are very remarkable in that direction. Fortunately, Cuba remains at a very low level, 330 dead people the whole pandemic. The lethality map is very clearly showing what happens. More dark colors here show how much people have been dying, and clearly leading is belonging to countries that were essentially had essentially wealthy, sufficiently wealthy not to avoid these kind of things. That's my presentation. I would like very much to ask questions if they are appropriate. Thank you very much.
Thank you, Dr. Montero. It's interesting. We picked nations that had a dramatically different response and a dramatically different consequence to the pandemic for this very purpose. So we could talk about how different health systems and the citizens responded and what effect it had on addressing and eventually overcoming the coronavirus. So our last speaker is Subhashish Bandyopadhyay, and afterwards we will take some questions. So feel free to continue to ask questions on chat. Subhashish, please.
Yeah. Thank you, everybody there. Very good evening from India. In contrast to other presenters, I do not have any slides to share, but some stories to tell. The Indian story starts in February 2020, when Prime Minister Modi invited Donald Trump here in India and organized a huge citizen forum to possibly commemorate their friendship. And that is when actually India was still open for international flights, and already the infected population crossed hundreds. Right before that, India was experiencing a kind of 6 months long Citizenship Amendment Act and National Registry of Citizenship protest, NRC and CA protest, essentially a kind of policy formulation to delineate the minority, especially the Muslims, in terms of their right to citizenships in India. And that's the starting point when Donald Trump visited India on a private visit. And since then, it's a long story. To cut the long story short, right now, when we are wrapping up and almost opened up and came out from the lockdown situation, we have another almost 100+ days of peasant agitation is there. It was on the outskirts of Delhi, New Delhi. They were actually barricading the roads, arterial roads, connecting to the further northern parts of Punjab and Haryana states. And they are protesting the three pretty ostentatious farm bill. And they're protesting by every possible way they could. And today they have arrived in my province of West Bengal from Delhi to participate in the political process of electioning here. So it's a kind of very wide-ranging mosaic of social reality here in India. The Indian experience is a kind of a mixed bag of perplexed policy, for policy. That means a policy which is not a policy at all. And there's a kind of the huge hiatus running throughout the society in terms of economy, in terms of culture, in terms of access to public health and gender, surfaced and resurfaced in myriad forms. For example, the domestic violence in the first 4 months of the lockdown in India increased to the tune of around 60% from a normal generic average because of the lockdown. That means more women suffered, just not with a enhanced burden of domestic chores, but also they were abused with greater intensity. Alcoholism increased, drug abuse increased. This is the one point. Even after that, when the lockdown gradually remained unlocked, 1, 2, 3, etc. Then the second part of discrimination that surfaced is that the schools and colleges and universities started to open, and offline classes were not there. That means no physical classes were allowed. And we are forced to take online classes. And almost it is 18 hours of time frame. Anytime, any slot is given to anybody. So the teachers must be ready 24/7, like the students to have a kind of experience of the online, I would say, fiasco of a class. The point is that the digital divide that is pretty predominant in this part of the world actually surfaced because there's a huge amount of dropout from various courses, including elite courses of engineering and medicine, and even general courses in the college and schools. People couldn't continue because huge amount of unemployment, retrenchment, and cutting of wages. So that is the other reality. And there is another aspect that even for a smartphone with a internet connectivity is not a kind of cosmetic device for many people here. It's a kind of very costly device. And even arranging a space and arranging for a internet connected device actually cost around 7 to 10% of our family income per month to continue the process of so-called online classroom teaching. That is the second part. The third part is that an uncritical epidemiological concept, social distancing, was accepted in India, which is already suffering from a cultural hiatus and with commensality, with untouchability, especially in the caste line, caste hierarchy, also across the various other segment of societies like the Dalits, Adivasis, and the backward Muslims. They suffered enormously. and social distancing was accepted as a term, almost universally accepted, that actually means a kind of safe physical distance. However, when we pointed out, the social scientist here in India, that we must not use such word as a kind of blanket procedure for feeling safe, because it is a kind of different cultural meaning and impact in Indian condition, which is already hierarchical, deeply stratified, and there are issues of untouchabilities rampant in many parts of the country. The third one, the fourth one is that the workers suffered the most when all our economists, major economists, luminaries, and Nobel laureates actually pushed the government to declare a kind of universal basic income program, UBI. The government never came out with kind of package. Even Trump did it in United States with some kind of monthly helpage. But in India, we just let the finance of the large chunk of the population, especially the urban workers, drive down, and no helpage came from the union government or the federal government here. And that resulted in a kind of huge, I would say, kind of disaster that is now possibly worldwide seen and commented upon, that 15 million people for around 3.5 months literally hit the street and walked for hundreds and thousands of kilometers to reach their villages. And because they were almost dying in a kind of distant small urban center or large metropolitan cities, without water, sanitation, food, and any access to civilized living. And around 850 people actually died when they were, that's the kind of standard government figure. 850 people died. Many of them were mowed down on the railway tracks en route to their village. One girl carried her father and cycled about 1,500 kilometers to reach her village, native village. And this is a kind of mosaic of, I would say, a policy paralysis. And especially if you look at the public health system in India, which was for last 60 or so years, was essentially public sector health system. That means hospitals were essentially by the government, including primary health centers. But the last 15, 20 years, increasingly, it tilted in favor of a privatization and commercializations of the health system. And majority of the states in India, major states in India, now have more number of private hospitals, which are almost have nil patients for 6 to 7 months. That means they were not taking any kind of patients, indoor or outdoor, for the fear of COVID. And even when they opened up, they actually made huge amount of profit for COVID testing and staggering the pace of the treatment. The entire public health system bear the brunt with all its shortfalls, all its imbalances. It was remained the kind of island of hope for the majority of the people in India. It's true that India relatively suffered less in terms of the infected and the rate of death, but India demographically is a young population, and the seropositivity test in Delhi and Kolkata, even in October and November, have shown that around 15 to 25% of the people already become, they developed a kind of immune response to the COVID-19 syndrome, and many people remained unaffected because of their comparatively young age. So India is a kind of admixture of wide variety of policy paradox, huge amount of I would say, the hiatus of the society, the cultural hiatus, and the economic hiatus in the society was torn apart. It surfaced so vividly. And I must say that, and at the conclusion, I must say that in India, the impact of the COVID and its outcome are likely to be felt longer, just not in terms of the economy and the productivity, but also in terms of the internal divisions of class and cultural divisions in terms of the population categories like Dalits, Adivasis, women, Muslim, and children. The impact is likely to linger, and we're waiting to see far more outburst and protest and resistance in India in the days to come. Thank you very much.
Thank you, Subhash. I often tell my students that are preparing a PowerPoint, don't put more than 3 points on a slide because we can't remember anything more than that. The information that the four of you just shared is remarkable, and I don't know if we can process all the information that you have shared with us. Before we leave today, I will post each of your emails in case any of the attendees want to contact you directly. It's hard to comprehend this. I mean, on the one hand, Luis tells us that Cuba already had a health system in place going house to house. Vietnam redirects their resources to deal with the public health, whereas Brazil seems to be blocking any public response to this, and it's got real racial overtones. And then Subhash, even though India has low numbers, indicates that it's very uneven. Youth may be one reason that there aren't as many numbers, and it also may be that the effects are felt in other ways, like through the caste system or some of the other effects that are related to the pandemic. So we're going to go until 11, which means we have about 20 minutes or so for discussion. There's already been questions posted. I'm going to try to present those to allow each of you to respond. Some of them are directed to specifics, so I will explain that if it's directed to you specifically. But one of the very first ones was a question about what were the consequences of the pandemic on employment and production and the economy. So that's a question for each of you. You talked about the healthcare system and you talked about the different responses, but what did it look like for the economy, for the quality of daily life and the production and employment and other aspects that you didn't touch on because we didn't ask you to touch on, but that was one of the very first questions. So, yeah.
I could tell you something about that. In fact, in our case, we had several facts affecting our economy. Since 2018, the Trump administration began to bring pleasure to certain politicians in southern Florida and began to sanction more and more Cuba. And just during 2020, facing the elections and facing Florida votes, Trump implemented up to 240 actions against Cuba, new actions. Practically during the pandemics, every week, the State Department announced a new action against Cuba. It was terrible. In fact, since the 90s, even before the pandemics, we suffered that every ship carrying oil to Cuba was sanctioned by the U.S. government. That means you could imagine how expensive it was made to find people wanted to bring oil to Cuba, and we need to import half the oil we need for half the oil we use for our energy purposes. And you could imagine that it damaged dramatically our economy. Our economy also have been damaged by our obsolete system of management the economy. We are just changing that now. A big action was delayed, waiting for better times, and was forced to be taken in January of this year to unify the currency in the country. And it damaged the economy clearly before, And it is now beginning to bring good results, but beginning to bring good results. I mean, that's the very second point we have. And in addition, as you mentioned, the pandemics came. Pandemic came and closed several economic activities. It was announced that the last year we dropped our gross internal product by 11%. It was the first time since 1994 when the socialist bloc fell down in the early 90s. Cuba lost 32% of the gross national product, and we were decreasing our gross national product up to 1994. 1994, we began to very slightly grow again, but this growing was more or less on a steady state until 2019. 2019, it became zero growing, or 1% growing only. And in 2020, we again dropped our economy 11%. You could imagine there was a very, very big impact on our point. With the policy we have inside the country, that no one remain without care. That means that we have not too much food, that not too much food is shared among all the whole population. Will not take it, and no one remains without food. That means that it causes also the scarcity of food, but its basic feeding is granted by the rationing system in the country, and that rationing system have been reinforced in place to be removed in the last month in order to face this big challenge. That's what we can say. We have our big problems from the economic point of view were not only the pandemic, was also the blockade, and also our conditions of the economy inside the country.
Thank you. There was just a note on chat that the US GDP dropped by more than 30% in the third quarter last year. So we keep that all in perspective. Are there other responses to the question? Yes, Gilshin. You have to open, there we go.
Well, the Brazilian GDP fell by about 4% last year, and our unemployment rates went drastically up. So there's a real problem, although there was a package of some kind of rescue money or support for the poor and the unemployed. That was a very hard negotiation between the Congress and the executive and the government. At last, some support was actually extended to the poor, to the unemployed, to the informal people working in the informal sector without actually holding any job contracts. This was the buffer to the recession. It was very recessive, and it must be remembered that before the pandemic, the Brazilian economy was already suffering from a very long-term depression of investments due mostly to the afterward of the 2008 financial crisis. We never recovered fully from that shock. And of course, the political instability since the impeachment of President Dilma Rousseff, and all the instability with the Temer government that came just, he was the vice president, and then the election of Bolsonaro, who has held a very strong and ultra neoliberal perspective, nominating a super minister of economy, Paulo Guedes, who is known as a Chicago boy. So his priority is to cut public expenditure. And the Brazilian economy is under a very, very serious constraint on, there's even a law that sets a ceiling for public expenditure. Nevertheless, the Congress was strong enough to negotiate with the president, with the federal government, the support package, and this avoided a much worse situation, as people could at least access that kind of support. This was already cut, and it's now under vote, and it's been going through again after pressure from the Congress and a fall in the popularity of the president. It's now approved a second round of support. So we are really under a very, very feeble growth perspective, very vulnerable to any shocks. And of course, since we have a very, very, I would say, unequal society where income distribution is really a problem, the fact is that the minor signs of recovery, of economic recovery, already give place to inflation. Why? Because there is a market, a markup pressure, an ability of the oligopolies, conglomerates, to actually impose price rises that will be faced by the well-off, the wealthier people, while the poorer people won't face it. So if you have a boost in the economy in an oligopoly, it's despite the recession, there have been signs of inflation, and then the financial sector pressures for rising interest rates. So the macroeconomic picture is quite pessimistic right now. The forecasts are of really not being able to recover to pre-pandemic levels. The political instability is still rising, and price increases, especially oil prices, are really up almost 40% since January. So just in the first quarter of this year, the state oil company has really promoted an unbelievable increase in prices that will be subsidized by the government. But on the other hand, it really mounts up in terms of inflationary pressure. So the economy has really taken a heavy toll, and perspectives are still bleak.
Okay, thank you. I have another question that can be for each of you. It's in a world where there's a claim that there's fake news, and we know that media frames things. One of the question is, how can we know that this data is valid? I mean, on the one hand, one of the questions, Vietnam had 35 deaths. How is that possible? How do we know that those numbers are anywhere close to being accurate? Or, as Subhashis pointed out, in India, the numbers appear very low, but the question would be, are they counting everybody? Different castes and just the mass burials. And even someone asked, Dr. Swartz noted that in January, there were a big increase in other deaths. Is it possible that some of those were misdiagnosed? Or with Cuba, one of the slides that Luis had said that Cuba has twice as many doctors per 1,000 as the US or Germany. How is some claims like this comprehensible for people that just question the the veracity of whatever information that you're sharing with us?
I'll start because it's a very quick response. The fact that the health system has been overloaded and many surgeries were canceled. Many hospitals are just beyond their capacity. This has been a big issue here because we are not only unable to face the rise in COVID cases, infections, and deaths, but the infrastructure is overwhelmed. So many other diseases are now, even vaccination in other areas that were already not a problem with us, you have the kind of overwhelming pressure. So you have rising COVID rates as well as all the disease going in the same direction.
Trying this question is really directed to you and Luis more than others, but
yes,
yes.
Thank you about the question. I think this is also a question also a lot of people also ask me when I tell, oh, Vietnam has only 35 people dead about the COVID-19. And they say, no, it cannot. The country hides the data or something like that. But I know a lot of the team, the test team also go and take the data. They check the data like maybe the government hide or not. But they realize the government and the Ministry of Health also cooperate with them to check every hospital, and they see the hospital no has the abnormal, like they had no the patient more. So everything is becomes the normal, and they see the Vietnam is still same. And you can see recognize when the first people dead in the Vietnam is the I remember it's the end of the June. This is the first time Vietnam has the people dead about the COVID-19, and the propaganda, the journals article, they have problem about how the transform information for the people. And you can see in that time the Vietnam updates the data like, oh, we had one people dead, one person dead, and then they delete the information, and in the end they update again. That means they show the government has some problem like, okay, now we have the people death, but how the population deal with that? But in the past, we don't have. Therefore, the articles, they don't say anything about the people death. And the relationship about the Vietnam, the society in Vietnam very close. If I think if someone death about the virus, and if like the government need to control them, I think they will cooperate and calling for family and outside the community to know about that. So I think the government cannot hide the data at that time and until now.
Okay.
Because I also remember the chair of the Hanoi city. He also said, if now we hide the data about the people infected and people dead, that means we will destroy the country.
Yeah. Okay. Thank you. I might note too, even if you number them 10 or 100 times, it's still a very low number. Subhashish,
Yes.
the question to
Yes.
you as well. How do we know the account seems to be low in India? And they sometimes say it's because there's so many young people in India, so that may be a reason. But how do we know that the numbers are close to being accurate?
Actually, there is no kind of the validity and the reliability of the data can never be beyond question until and unless there is a complete independent and autonomous institute which are continuously carrying and monitoring the situation. Say, for example, in Indian economic scenario, when CMERI, Center for Monitoring Economic things, when that comes out with the kind of statistics, normally we try to validate in terms of our micro experience. But when it comes out to health, it's really very clouded. Very clouded in the sense that in India, after 1 or 2 months, suddenly there's a policy shift. That means the government started counting the comorbidity, the other factors like hypertension and hypoglycemia, and that are contributed into the COVID condition. And that is being cited as death due to comorbidities. That's the kind of certification. But you know, in an economy like India, where poverty persists, and with a kind of a pretty deep impact in the economy till to date, poverty is not considered as part of the comorbidity or the lack of nutrition. And actually, every year, many people, including kids between 0 and 5 years, die due to malnutrition and lack of potable drinking water. So, given this scenario, on a hindsight, we can say that we'll never get the statistics. But yes, India has a demographic benefit. It's a young population, and I already told you that in Kolkata and Delhi, by end of October, already more than 15 in Delhi, in Kolkata, and 25% of Delhi, they've proven to be seropositive. That means they're already infected with a kind of infection, but get cured. They never understood or never had felt any kind of thing. Right now, till December, the statistics goes like that. Per million, the Indian RT-PCR test, reverse transferase test, which is a standard, gold standard for such identification, it is around 82,000 per million. That means we are a long way to go to really catch up with the kind of standard of statistical inference to predict a kind of real mortality rate out of COVID itself. I believe that in India still today, malnutrition and hunger and pollution are greater impact factor for death rather than COVID today. Thank you.
Oh, thank you. Luis, in the United States, according to the Biden administration, the only Cubans we can believe live in Miami. So I wonder how can we accept your account of Cuba?
Well, first you asked about the number of physicians. In fact, it responds to a policy that began in the middle 70s last century to increase the number of doctors. Cuba had at the beginning of the revolution 6,000 doctors in a population of 6 million people at that time, and 3,000 left for USA at that time. And the country remained in a very critical situation of doctors per capita. And the Cuban government employed a huge amount of resources for educating doctors and it increased dramatically since the middle of the 70s last century. Now we are practically graduating thousands of doctors per year, including we are having a school for educating doctors from other countries, including USA, by the way, but graduates around 1,500 doctors per year. That means that we are having an appropriate number of doctors, and that doctors are occupying the care of people by zones, by regions in the country, and also to export the medical services. That exports of medical services are serving for sustaining that policy. In fact, you could imagine that probably one of the causes of that scarcity of goods in this country is because the central budget of the government is dedicating a huge amount of money for public health and for educating doctors. That is completely free for everyone accessing to that. That means that it is a policy for caring those facts in the population that are normally not too well cared everywhere, are even commercialized everywhere. We are having that doctors, we are having, all of them are not in Cuba, both for the reason that some of them emigrated. We are having a big problem now with immigration of brain from the country to other countries. And also, we are bringing that services to several countries. In the case of Venezuela, for example, the agreement is we are bringing to the huge proportion of the Venezuelan population having no medical services. We are bringing them medical services, and they bring us oil. That's a deal, and it's a very fair deal in principle. I think that's the way. The reason because we are having such a big amount of doctors clearly on land, directly taking care of people. Perhaps it could be smaller. The figure could be smaller because other doctors are employed in these other duties abroad and things like that. But in principle, the rate is good. Practically every family in this country is having a doctor in their family. You can realize it very easily.
Very good. This conversation obviously is the opening to what could be a larger conversation. I know here at Purdue, we have one of our Center for Global Studies faculty teaches a class on global health, which includes a book on healthcare in Cuba by, and this conversation, you've shared with us so much information, it's really difficult to process. And if each of you agree, I would like to leave the screen up as we end this session so that people that might want to contact you directly for some of the things that you shared and they didn't get to write down. I know Gilshin had some things, and Luis had some things, and Trang had hers, and people may want to have access to that. So if it's okay with each of you, I will post your email addresses, and anybody that wants can send you an email. We've reached the end of our allotted time. Our class schedule here at Purdue says the class is very soon for the next session. So I want to profusely thank each of you for your contributions. I wish we would have more time. I hope we can collaborate again on future projects. But thank you, Trang. Thank you, Luis. Thank you, Gilshin. Thank you, Subhashish. Thank you, the Center for Global Studies, the Mass Peace Action, and all of the participants that were here today. This has been astounding. Thank you so much.
Thank you. Thank you very much to you, Lee.
Everyone.
Thank you.
That's
Thank
for
you.
you.
Thank you.
Good. I'll leave this
Bye-bye.
up just a second. That has everyone's email, so anybody that wants can write those down. Goodbye, everyone. Thanks.
Bye.
Bye-bye.
Yes.
Stay healthy.
Thank you, Jason, for your help. I couldn't have done it without you.
Oh, yeah, my pleasure. I think it was really, really great. That was fantastic.
There was just so much information. I couldn't process it. It's like a big potpourri or paella or something. What's in the pot? I don't
Yeah,
know. It was
we could
incredible.
do
So
this for hours and hours and
Yeah.
just, so. So make sure, I just sent the host duties back to you. If you want to go ahead and make sure you do stop recording.
okay, that's under
So down by, if you scroll down by your controls,